Hello everyone, I am Dr. Sasi Kumar. I am a plastic surgeon, and in this video let us discuss about treatment options in androgenetic alopecia. So what is androgenetic alopecia? It's a genetic hair loss, most common cause of hair loss in men. And what happens in genetic hair loss is that we don't see typical hair fall as in other conditions like telogen effluvium. Here there is a condition called miniaturization where the hair tends to become thin and thin and thin until it disappears. So it's a gradual process wherein you don't actually see hair falling, but it just disappears without you even knowing about it. So hair growth is also affected. Hair growth cycle is also affected in androgenetic alopecia, and the hair is predominantly in resting phase. The percentage of hair in the active phase is very less in androgenetic alopecia. So the cause in genetic hair loss is basically the presence of increased DHT. So what happens here? The DHT may be normal in the circulation, blood circulation, or in the system, or it may be elevated. But still, even if the DHT is normal, DHT is dihydrotestosterone. It is the androgen that we are concerned about. So this dihydrotestosterone is the active form of testosterone. So this DHT level is locally elevated at the level of the hair follicles. There is local elevation of DHT at the level of the hair follicles. Also, there is elevated 5-alpha reductase enzyme, which is responsible for conversion of testosterone to DHT, which is also increased. As I told you, DHT may be normal in the system or it may be elevated, but that is not what we are worried about. Local levels of locally elevated levels of DHT at the hair follicle is what is our concern. So there is also a receptor sensitivity which is increased in people predisposed genetically for balding. Now, what is the normal hair growth cycle? The normal hair growth cycle consists of 3 phases: anagen, catagen, telogen, and again return to anagen. Anagen consists of thick terminal hairs, last for about 3 to 5 years. Predominantly, all the hairs in our scalp are in anagen phase. So this miniaturization which we are concerned, in this picture you can see that there is a thick terminal hair. This is what is called an anagen hair. This becomes thin and finally a vellus hair. So the conversion from terminal hair to miniaturized hair to a vellus hair is what happens in a genetic hair loss, and this is exactly what we are trying to prevent by way of medical treatment. So medical treatment forms the first line of treatment in androgenetic alopecia. This is a clinical picture where you can see that the front of the scalp has thinning and lots of gap, and there is miniaturization of hair. Same patient in the back, he has got lots of thick anagen hairs, which you can actually harvest to do a hair transplantation. The back of the scalp and sides of the scalp are not affected in androgenetic alopecia. And this is one more picture where you can see thinning and miniaturization, eventually loss of the hair follicle. So what is the goal of medical treatment? Why is it so important? The medical treatment basically is causing stabilization of the hair and the scalp. So whatever hair is remaining, the aim is to prevent further loss of those hairs, and also to increase the density and thickness of the hair, which is why we start the medical treatment. So medical treatment basically consists of 2 sets of drugs. One is a blocker, another is a stimulator. The blocker is the 5-alpha reductase enzyme blocker. This enzyme causes conversion of testosterone to DHT. So the DHT, we are trying to reduce the elevated levels of DHT at the level of follicle. Other treatments include microneedling, mesotherapy by growth factors, artificially available growth factors. Hair transplantation is the last step. It's a surgical procedure. And autologous PRP has been very useful. I'll discuss about this in my next video. Janus kinase inhibitors have been promising in conditions like autoimmune hair loss. So DH levels are locally elevated at the follicle level. Also, there is increased 5-alpha reductase enzyme representation locally. Also, there is increased receptor sensitivity. These three are the main causes in androgen related hair loss or genetic hair loss. So, what is this enzyme? There are three types of this subtypes of this enzyme: type 1, 2, and 3. Finasteride, the commonly used drug, is a type 2 blocker. Dutasteride blocks all the three subtypes. This picture shows clearly testosterone getting converted to DHT by this enzyme, and DHT gets attached to the receptors which are increased in number in genetically predisposed individuals, and the receptor is also very sensitive to the DHT. Even if there is limited number of receptors or increased number, it is more sensitive to DHT, and thus becomes the hair follicle becomes thin and gradually miniaturizes. Coming to the most important part of the treatment, that is the finasteride. People are much worried about usage of finasteride. People think it causes lots of sexual problems and other side effects, but it is not the case with finasteride. Though there is a risk of very minimal or negligible risk of side effect. I'll discuss about it. It is 1 milligram per day for a year. That is a dosage recommended for treatment of genetic hair loss. It improves hair width and hair count, prevents progression of hair thinning in genetic loss. At the follicle level, DHT is not completely blocked. So, finasteride does not completely block the level of DHT at the follicle level. Hence, it does not totally block the conversion of a good hair to miniaturized hair. That is why even with the treatment of taking medications, you could still be losing or you could still be getting bald. Hence, medical treatment is not 100%, but it is definitely very effective in androgenetic alopecia. Results of finasteride usage are seen after a month, and continued usage is required to maintain results. Also, we have to be very careful in which set of patients we can give finasteride for a longer period, and where we have to cut short the treatment and give it in breaks. So this we have to see when the patient comes to us for personal consultation, and then decide on how to give finasteride. Dutasteride is a congener, and it blocks all three isoenzymes, very strong in action, but safety profile is not yet very clear, hence it is uncommonly used. So side effects of finasteride include decreased libido and causes erectile dysfunction, but the side effects are very less than 1% in young healthy males, can be sometimes higher in diabetic smokers and older age groups. Finasteride can be given in females but should not be given in pregnant women and breastfeeding women, can cause fetal problems. Topical finasteride, as in local application of finasteride on the scalp, is not much effective, but there are combination of minoxidil and finasteride solution available in the market. Hence, the monotherapy is not very effective. I would say finasteride is the most effective drug in treatment of androgenetic alopecia. Combined with topical minoxidil and other modes of treatment, the effects are cumulative. Minoxidil is a time-tested medication available both in tablets form and in solution form. Solution form is commonly used, available in 2 and 5%. Induces stimulation of growth factors. 5% is effective in men. 2% is given in females because it can induce facial hair growth with 5%. It lengthens the anagen phase and retains hair in the scalp for a longer time. So with continued usage of minoxidil, 50% of men may have satisfactory results, wherein they have seen stoppage of hair loss, and in small percentage hair regrowth is also seen. Improves hair growth and it prevents progression to balding. Minoxidil solution also can be used continuously. A response is usually evaluated after 6 months. It is also a subjective response, but you can also see clinically that the hair growth actually improves with minoxidil. Minoxidil side effects include irritation and allergic contact dermatitis, can have mild headache. This is because people alcohol content in minoxidil can cause mild headache and irritation. But this is important because it aids in better penetration into the skin. There are foam-based solutions also available which can be used. Minoxidil prolonged usage is very important because in the first 3 to 4 weeks of usage of minoxidil, one can see there is increased shedding. Many people discontinue usage and blame the and find fault with the solution itself. They say the drug doesn't work well, or it's not doing its job. But the effects of minoxidil are seen only with continued application. First 3 to 4 weeks you could have shedding, but as the time progresses, the volume and quality of hair improves. So this was about the medical management in androgenetic alopecia. About autologous PRP, which has promising results, I will discuss in another video. Telogen effluvium is a condition where patient can lose hair because of other reasons like nutritional deficiency. In such a case, finasteride is not effective. We can supplement nutritional supplements like vitamins and minerals and antioxidants that also improve the quality of hair. Thank you very much.